Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Friday, January the 29th. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands. We will be providing a briefing on Monday at the Press Gallery Theatre in Victoria at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry. I think it was 1 year ago and 1 day that Dr. Henry announced the first case of COVID-19 in British Columbia. And so there have been a lot of days in between then, and it's still a great honor to introduce her and about the work she's doing. Dr. Henry.
Thank you very much, and good afternoon. Today, to start with, our case update, we have had 514 new people diagnosed with COVID-19 in British Columbia, including 6 epidemiologically linked cases, bringing our total number of people diagnosed with COVID-19 to 66,779 in British Columbia. That includes 134 people in the Vancouver Coastal Health Region, 223 people in the Fraser Health Region, 29 people on Vancouver Island Health, 71 people in the Interior Health Region, and 57 people in the Northern Health Region. We now have 4,557 active cases in every health authority, of whom 292 people are in hospital, 74 of whom are in critical care or ICU. We have at least 7,000 people still now under active public health monitoring, and 59,551 people who have recovered to various degrees, as we have learned from COVID-19. Sadly, we have had an additional 5 people who have died from COVID-19 in the last 24 hours, bringing that total to 1,189 people. Our seniors, our elders, our family members, our friends, our community members. And to all of the families, the care providers, communities who have lost people, our thoughts and condolences are with you again today. We have had one new healthcare facility outbreak at the Holy Family Long-Term Care, and sadly that is a single case so far, and we know that the investigation will continue there. On a positive note, the outbreaks at Mayfair Seniors Living Care, at Morgan Place Care Family Facility, and at Little Mountain Long-Term Care are now over. And I know the tremendous sense of relief that will be for the family members, the care providers, and the communities who have watched and have had loved ones involved in those outbreaks. We now have 25 active outbreaks in long-term care and assisted living and 9 in acute care units, involving 926 residents and 520 staff in long-term care. And while we've had no new outbreaks or clusters in communities, we know there are a number of ongoing ones in communities around the province today. Since the start of our Immunize BC program, 87,346 people have received a COVID-19 vaccine in BC, and of these, 4,262 people have received a second dose. And it is also very exciting to share that all long-term care residents and the people who care for them have been offered vaccine in all health authorities around the province. And we have very high uptake, and details of that we will be providing in the coming days. Our vaccine supply, however, is proving to be a challenge, with, as we've reported on before, the Pfizer vaccine having no doses arriving this week and reduced doses for the following 2 weeks. We are reassured that that will increase again in the third week of February, but that does leave us with a much less supply than we were intending. And today we were advised that the supply of Moderna vaccine that's scheduled to arrive next week has also been reduced by about 20% due to some difficulties at the Moderna processing plant. Of course, this is disappointing for all of us. We are working with what we have available to best address those most at risk and those hotspots and outbreaks that are happening in communities around the province. But starting next week, we will be getting back on track. It will be slow and slower than we wanted, but we are confident that we will be able to meet our Phase 1 and Phase 2 objectives as quickly as we possibly can, and that we will be ready once we have vaccine to be able to offer it, as we've outlined, to everybody starting in April. I think everybody will agree that this has been an extraordinary and challenging year. And today in particular, as I stand here again, I'm struck by how most, if not all, of our normal rituals to mark things like significant changes in our lives, even our day-to-day rituals, have been thrown apart and reassembled in ways that many of us may not even recognize. Everything from births to deaths, weddings, anniversaries, graduations, all of those markers of those important milestones in our lives, all these transitions, along with the ceremonies that we use to have to mark these with each other, with our families, with our loved ones. Even our daily rituals have changed, but we have adapted. We've adapted to wearing masks. We've adapted to keeping our distance. And we've adapted by being able to support each other. We have learned so much in this year. We've learned as well that we are connected, a global community, in ways that perhaps we have not appreciated before or perhaps had ignored. And therefore we've learned that what happens in a remote community in China affects us here. What happens in a production facility in Belgium affects us. But we've also discovered that our individual actions can and do make a difference every day. That taking the individual actions to keep ourselves and our loved ones safe are also the very things that keep our communities safe. Every time we keep our safe distance, we wear a mask, we clean our hands, we stay home when we're ill. All of this makes a difference for those we love and for those we don't know. We in BC and in Canada have weathered this storm this past year by doing our bit individually and therefore collectively. We have all benefited. We have done this by bending our curve, not the rules, and by standing together and staying apart. And over time, through these months, we've learned that crises such as this pandemic can bring out both the worst and, thankfully, the best in our human nature. It's times like this when altruism is so important, and we have seen so much of that in this past year. People dropping off food for neighbors, caring for others' children, looking out for each other, looking out for our neighbors, supporting our food banks. These are things that have made a difference to us in our communities and our families across the province. As well, we have seen that when we have many unknowns, as we have had and continue to have, even to some extent today, misinformation and fear can fill those gaps because we are fed by our own past experiences, by rumors, by stories, by media, and of course, social media. But we have responded in BC by recognizing our need for connection, for compassion, and for community. Acknowledging that we are in this together, even though we come from very different places. It is our sense of common purpose that will build that resilience to support us all as we continue through this storm. We have also learned that we can be resilient and adaptable, even when it is hard. That social connections, even virtual, are essential. That compassion is stronger than cynicism, and that there is still joy and beauty in this world, even when we are faced with unrelenting uncertainty, as we all have been in this past year. This pandemic, as I have said many times, and all we must do to weather it, is not forever, but it is for now, and it is something that continues, even in this period of hope and challenge. It is our community and our compassion that will see us through this storm. I know we will be together again. I know we will be able to take off our masks. But in the meantime, our task right now is making sure that we continue, as we imagine that future from the middle of this storm, that it remains our time to continue to be kind to each other, to be calm, and to stay safe.
Thank you very much, Dr. Henry, and I want to start by recognizing and sending my condolences, and that I think of everyone in the province, to the families, the friends, the caregivers of the 5 people who passed away in the last day from COVID-19 in British Columbia, 3 in Fraser Health, 1 in Northern Health, and 1 in Vancouver Coastal Health. Their loss, especially at this time, especially after this 1 year since our first case, is difficult, as difficult now as it has been throughout the pandemic. And I want to assure everyone that our hearts and our thoughts are with them today. I want to note, Dr. Henry noted that we have 292 people in hospital diagnosed positive for COVID-19 at present, and that is relatively lower than it was earlier in January, and obviously that's a good sign. In terms of our hospital capacity, which we periodically update you on, that's 88.7% of beds are occupied of base beds. That leaves us unoccupied 1,063 base beds at present in our healthcare system. When we count the surge beds that have been put in place, that occupancy rate is 70.2%, leaving 3,553 beds available. In critical care, 75.4% occupancy of our base beds, leaving 131 critical care beds unoccupied, and 51.9% when you count the surge beds that have been put in place. And that's 372 beds unoccupied. So we continue in terms of our healthcare system and acute care to manage across the province. But that doesn't mean there aren't significant issues. You will know significant issues at Royal Inland, significant issues at St. Paul's, significant issues in parts of the province that have higher rates of COVID-19 right now. And the challenge everywhere in the healthcare system of dealing with a pandemic and dealing with everything else continues to be there. I want to note, as I update you on our surgical renewal commitment, you'll note that health authorities resumed non-urgent surgeries on May 18th and have completed a combined total of 229,504 surgeries as of January 24th, 2021. In terms of the most recent completed week, we've done a completed assessment, which is January 11th to 17th. Health authorities have verified their data, and the total number of surgeries completed between January 11th and 17th was 7,282. That is 426 more surgeries than the same week last year. And as noted, considering the pressure in our healthcare system, that is an extraordinary achievement by our healthcare workers, by our surgeons, and by our nurses in the healthcare system, and everyone involved in dealing in continuing surgeries. And it's a real achievement for everyone. I appreciate. I want to make sure that everyone understands the effort that has been made up to now to deal with that situation. I also would note that we continue to make progress in immunization and long-term care, and most importantly, we're seeing fewer outbreaks in long-term care. The end of the long-term care outbreaks, particularly at Little Mountain and at Morgan Place, which had a profound effect on those communities, is something we recognize, and while we contemplate all that everybody involved has been through. We had 2 weeks ago 42 outbreaks in long-term care. We now have 23 active outbreaks. We had 7 outbreaks in assisted living and independent living combined. We now have 2. And that is progress, and it reflects our immunization effort. Dr. Henry noted, and we will be providing on February the 8th, detailed facility-by-facility data with respect to immunization rates, but the total numbers are significant. As you know, we've 129,241 people across the province have been vaccinated, and in long-term care of residents, that number, and this is not final, every long-term care facility has now had clinics, but it's 26,584 residents, 33,708 staff to date, and 7,846 assisted living residents, 4,290 assisted living staff. So those are significant, and that represents significant progress, and we see that progress reflected in our results. And obviously, it's very gratifying. The day an outbreak is declared, I know this from personal experience, the day an outbreak is declared is a terrible day for any residents and family, and the day that it's declared over is a day of relief. And we want to note that today in these cases, and note the progress we're making, but everyone needs to understand that while vaccination and the first dose vaccination is one step, that we have a long way to go, and we have to keep doing our work. I wanted to speak about a question that I was asked at an earlier event today with respect to a case in the Northwest involving the hospitals in Kitimat and Mills Memorial Hospital in Terrace, and the loss of a child. And this is obviously a terrible thing to experience. and our hearts go out to the family. To maintain confidentiality and privacy, we cannot speak to the specific situation. However, we expect those in our healthcare system across our province to provide culturally safe care to Indigenous people and all patients, no matter the situation. Allegations of racism are always taken extremely seriously. There is no place for racism in our healthcare system, and any discriminatory or racist behavior is a violation of our principles, policies, and values. Northern Health has initiated a review which will work with the family and the healthcare providers to determine exactly what happened in the situation. We acknowledge that systemic anti-Indigenous racism exists in BC, and while some steps have been taken to make healthcare safe and accessible, there is much, much, much more to do, as Dr. Mary-Ellen Turpel-Lafond's report has demonstrated. In closing, I wanted to say that as we move through the pandemic, we can worry that COVID-19 is always one step ahead of us. We know that COVID-19 lives to spread. But what I see in my community, and I know it is happening in every community, is people taking the actions necessary to stay one step ahead of COVID-19, doing what's required and often more to keep themselves and their families safe to stop the spread. And I want to speak to all those people just briefly who are doing well beyond what we're asking them to do to stop the spread. And this is to say that we recognize you, we see what you're doing, we understand what you're doing, we understand that many people are not visiting family members who they love and want to see because they want to protect them from COVID-19. We see that action. We understand people feeling an evident frustration and thinking, how much more can I do? Because you're doing more than you're being asked to do. And I say we just have to continue doing that. And I want to express our appreciation. There are some people who need to do more. And it's never too late to join our effort to stop transmission of COVID-19. We need to use our skills, we need to follow our guidance, and we need to abide by public health orders. And when we do that, we help put COVID-19 in our rearview mirror. We keep COVID-19 one step behind us. The compassion we show and the example we set remains the lead to follow. When it comes to COVID-19, stopping the spread keeps us one step ahead. And that is something we all need to reflect on this weekend when we're making decisions. This is a critical time, a critical moment in the pandemic. We are making progress in some important areas. There are real challenges ahead. And I want to say thank you to everyone. Thank you to everyone for all that you've done in the last year on behalf of all of us, to protect those you love and those you don't know. And we know it, we see it, we thank you for it, we appreciate it. Thank you. Aujourd'hui, nous annonçons 514 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 66 779 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 5 nouveaux décès liés au COVID-19 pour un total de 1189 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 292 personnes sont actuellement hospitalisées, dont 74 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And we will now take questions. But before that, a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. And as always, please do not mute your phones. You will not be heard until I call your name. We begin today with Marcella Bernardo, News 1130.
Can I just, before you go, Marcella, just to note that I made an error in reporting the number of people who were immunized. The minister had it correct. My apologies. It's actually 124,979 people who have received one dose and 4,262 people who have received 2 doses. So apologies for that.
Thank you, Dr. Henry. And Marcella, you're on.
Thank you, Dr. Henry. I was going to try to ask, will you save me having to waste a question on that? With the arrival of the UK and South African variants in BC, I'm not sure how much you can talk about that, but what extra steps are being taken to ensure the safety of schools, especially now as numerous exposures are again being recorded, not just in the Lower Mainland, but in the interior as well?
Yes, and that again reflects the fact that as we have transmission in our community, we see exposure events in schools. But once again, my hat goes off to our educators and people in the schools who are making sure that those measures are in place to make sure we reduce the risk of transmission in schools. So we've had very little transmission in schools. We have, and I will be giving a weekly update on what we call variants of concern now. We have added another acronym to our year of acronyms. So this is VOCs, our variants of concern. We are now up to 7 of the variant that has been associated with the UK. And that's the B1.17. And we have 4 of the variant associated with South Africa. 2 of them are linked. And then we have 3 individual people who, again, most concerning to us, are not associated with travel. And we are continuing an investigation. We have not seen any onward transmission, but the contact tracing is ongoing with all of those cases. And we do have a number of measures that we're doing to try and understand the variants in our community. And part of that is the BC CDC doing the whole genome sequencing and developing some techniques that we can rapidly screen tests, positive tests for the variants. We're doing specific testing in outbreaks, including in younger people and in schools, to make sure that the variants aren't getting into those environments. And so far, we have not had any school-related exposures or any of the outbreaks that we've had in long-term care or in acute care that have been associated with any of the known variants of concern.
Do you have a follow-up, Marcella?
I do. It's regarding addressing some of the mixed messaging that people seem to be hearing when it comes to allowing ski resorts to stay open, knowing that the risk linked to après ski behavior with social gathering, and then movie theaters now forced to operate as sports bars when there's no exposures that have been recorded there. Like, just how do you reconcile that? You have said before that we're trying to reduce social gatherings, but that doesn't seem to be working in places like Whistler.
Yeah, and these are comparing very different things. I think we need to be cautious about saying there was no transmission in any specific venue. There have been specific places that have not had transmission, but we have seen transmission and exposures in a variety of venues. And it's the events that we have seen those in that we have put the closures in under the public health orders. And that includes cinemas and movie theaters and theaters. So you will know as well that we have some very strict protocols, including reduced hours, spacing, barriers, mask wearing. People must sit at a table. You have to have you can't have movies playing, for example, or things that are at a high level. And we are increasing our inspection of those areas. Yes, it is a challenge because we are trying to keep those small businesses open as much as we can. And restaurants and bars are a good example where they provide food, where they cannot have events, where they have to have restrictions on numbers, etc. And where we are seeing people flaunting those rules, it is the challenge that we're seeing, and Whistler is a good example. There's been at least 6 premises that have been closed or had orders issued on them because of people not obeying the rules in those environments. It is trying to find that balance. The risk is not on the ski hill, and we know that for many local people, going to their local ski hill is an important way of getting away with your family, with your household, and having some physical activity outdoors. We are working with the industry, with all of the industries involved, to come up with a community way of supporting this. I will also say that we have orders in place from the summer when we saw similar things happening around vacation properties in the interior, and those orders say that you cannot have gatherings in rental properties. and we need to step up our enforcement on some of that. So those are things that we are working with behind the scenes with our different ministries as well as communities around the province. And you will see some more on that in the coming days.
Thank you. The next question comes from Keith Baldry.
Hi, thank you very much for this. Just on the Moderna vaccine, could you shed more light on the impact that has on BC? From our 13.6% allotment, is that about 6,000 doses fewer than we expected? And just in terms of certainty, how certain are we that Moderna will actually come through in the end with its required dose allotment?
Yeah, so it was, again, it took us a little by surprise. We had not heard that there was going to be concerns, although there has been some rumors swirling. And yes, it's about 6,000 doses that we were expected to receive next week. We have assurances from the federal government, who have been talking directly with both Pfizer and Moderna, that these shortfalls will be made up before the end of Q1, and that we will be Canada will be provided with the doses that under contract for Q1, which means the end of March. So yes, we are slightly more delayed. We have had a plan for the next, we included up until the end of February in our slow down and focused plan over the last couple of weeks to make sure that we could account for any eventualities. It does mean that we're going to have more of it come centrally and manage it provincially so that we're able to hit hotspots where we can do the most benefit. But it is going to be a challenging few weeks, and that's really, what can I say, it's frustrating because we started to see the benefit of this, and I am just relieved, tremendously relieved and grateful that we've been able to get into every single long-term care home and assisted living facility in this province, every single one, and have offered protection to those our most vulnerable citizens. So that part is the most important piece, and we are now moving on from there for the other people who are most at risk as well.
Follow-up, Keith?
Yes, today Health Canada released a statement saying it expects to make a decision on the AstraZeneca vaccine in the coming days. Many people think that's going to be a green light. And Johnson & Johnson released a statement today saying the efficacy of its vaccine was something like 72% in the States. Given what's going on with Moderna and Pfizer, does that underscore the importance of getting these two vaccines next online in the next quarter?
Yeah, there's lots of exciting news and positive news if we could just get the vaccines. So yes, we have been working with the National Advisory Committee on Immunization, the special advisory committee that I'm part of, and we're meeting again on Sunday. So we are very hopeful that AstraZeneca will be approved in Canada. Health Canada, the regulator, has been working very closely with the EMEA, the European regulator. So that is good news for us. Obviously, they don't tell us until they've had a full assessment of all of the data, but we are meeting on Sunday morning to talk about that, so I expect it will be soon. The other part of it, though, is when it will be available in Canada. And, you know, the AstraZeneca vaccine is being used extensively in the UK and will start to be used in Europe as well as in India. And the things that we know about AstraZeneca is it works better in younger people. I mean, we are so lucky. Lucky, I don't know if it's luck or the fact that the messenger RNA vaccines work so well in older people. That is great. That is something that is, from a public health perspective, it's novel, and it's one of the most positive things that we have. The AstraZeneca vaccine works really well. The best efficacy was in younger people. So that helps us in terms of our strategy for looking at people who can't work from home, our essential workers and others. So we'll be looking at that very carefully in the coming days. The other one, Johnson & Johnson, it's a single-dose vaccine. It was not as efficacious in the trials as the either the AstraZeneca or the messenger RNA vaccines, but they are doing additional trials looking at 2 doses and seeing whether that will improve the the vaccine effectiveness. Having said that, a single dose that provides 70% effectiveness is going to be also a very positive thing. Considering we have zero protectiveness right now, having that for especially it as well works better in younger people, it seems. So that's a really positive one. And the other one is the Novovax vaccine, which recently released results, interim and preliminary results of their phase 3 trial, which showed as much as 90% effectiveness in the studies that were done in the UK and US. Less effective on the South African variant. At least one arm of their study that was done in South Africa didn't seem to work as well. So we are following all of those very closely, and they will fit into our plan, our immunization plan that we laid out a week ago in specific areas, and we'll be using them in the people in whom they work best.
Thank you. Binder Sargent, you're next.
Thank you. Dr. Henry, I've heard you speak before about Family Day and Chinese New Year. Given that these new federal travel measures are in place until April 30th, what do you say to people who might be considering travel for spring break or even Easter?
Yeah. You know, spring break is something that we're going to have to do at home. You know, I hope, and given where we are with our immunization program, with transmission, with all of us continuing to do our bit, by the time we get to spring break, we'll be able to safely travel within BC. And we need to think about that within BC, going to our ski hills and going to our campsites and other places. But these things will become clearer as we get towards later on in the month and into March. We will be actively discouraging people from other provinces coming to British Columbia. We are very supportive of the international border measures that have been put in place. I think that's fabulous. It's going to protect us in this very critical few months where we don't yet have enough people protected from this virus. And we have the concern about importation of different strains. So the fewer transmission events that we have in the world, but also in Canada and in BC, the less chance there is for the virus to mutate. So all of the things that we do to stop transmission are important for us individually, but also collectively. And, you know, I made reference to that a little bit because we don't realize maybe how much the little things that we do make a difference. When we see the virus take off and cases take off, it means that the virus is replicating more often, more frequently. It means even if it mutates slowly, those mutations can start to build and grow. So travel restrictions are one of those measures that helps us keep out new strains that could disrupt our ability here, but we all need to still do our own measures. So absolutely, you should not be thinking about international travel for vacations, for leisure in the next few months. If we can get this under control and get people protected, you know, we can have a summer again. Let's think about that. Let's think about how we can get there. We can get there safely and not have more of our family members, our community, be affected by this virus.
Follow-up, Binder?
Yes, and you said there that you would be looking at measures to actively discourage people from other provinces from coming to BC. Are you looking at implementing some sort of restrictions there? And can you just clarify again, just on local ski hills, if you're in Vancouver, can you go to Whistler? If you're on Vancouver Island, can you go to Mount Washington? Thanks.
Yeah, you know, all of these details are things that we are still in discussions with. I would say, you know, day trips are less risky with your family, your household. If you're somebody who works or has strong connections and lives partly in Whistler, then yes, that is your local ski hill. Day trips to Mount Washington, it's, as we said, it's not the skiing itself that seems to be the risk. It's the things that we're doing before and after, and particularly if we are staying over, having people over, and that is what we're seeing in a number of places around the province.
I just want to say in the summer, there were a number of cases in interior health around Kelowna. And at the time, Dr. Henry and medical health officers responded with rules about temporary rentals. And those rules apply. They apply to those renting properties, and they apply to those who rent out the properties. So those obligations are on both sides. With respect to rentals, for example, condo rentals and parties in condos and so on, there are strict limits, even when such activity takes place, and those limits apply in those cases. They prove to be effective in Kelowna, where we turned back to read the rise in cases there in the summer. People listened, they followed the rules, and things got better. And that is our expectation everywhere.
Thank you. And the next question comes from Gordon Hextra, Vancouver Sun.
Thank you. I just wanted to be clear that the vaccinations include all assisted living care homes, and what percentage of people, the staff and residents, have accepted those vaccines in long-term care homes and assisted living?
I don't have the exact numbers for each care home. Those are being compiled, but it is very high. And in many homes, I'm hearing reports from my colleagues on the front lines that it's as high as 100%. There's not everybody who is able to receive the vaccine, and we went into a number of long-term care homes when they were having outbreaks to prevent that next transmission level or the next circle of transmission. And some people who had recently been diagnosed who were still ill with COVID-19 were not eligible to be immunized. But it is in the very high rate, and my understanding is that all assisted living facilities have been visited. They may not all have, not everybody in the facilities may have been receiving the vaccine yet. Is that correct? Can you understand? Yeah. We'll get more information on that. We are compiling the numbers. It's not as easy as it sounds to know exactly who works in which place and exactly what the percentages are. But obviously, that is something we are very focused on understanding.
Do you have a follow-up, Gordon?
Yeah, you mentioned about hotspots. I'm just wondering what you're sort of wanting to use this, whatever vaccine is left, and we're getting in this, the reduced amount, and will the plan that was outlined several weeks ago that included sort of the priority groups by the end of March. Do you expect to reach all those people still?
The short answer is yes, and we are working out how we're going to do that. So the hotspots that we're talking about right now are some hospital outbreaks that we're seeing. St. Paul's, Royal Inland Hospital, in Royal Columbian Hospital are having flare-ups with both patients and staff being affected. So we are focusing on those. We have transmission in some of our shelters, both in Fraser, in the Surrey area, and Vancouver and the downtown east side. And we know that people in those situations are much more likely to get severe illness, end up in hospital. So we are doing some targeted immunization in those communities. There's also a number of First Nations communities where we have some serious outbreaks. And those are some of the areas that we're focusing on. I'm missing one thing. Oh, and in our provincial corrections, we have some serious outbreaks in 3 of the provincial corrections, the pretrial areas. So those are important to get under control as well, a higher risk population. But yes, we absolutely, our focus is on getting immunization to all of the high priority groups by the end of March, and that includes people in the community who are 80 years of age and over, and we have 250,000 people in BC who are in that category, and we're working out how we can reach out to you and make it easier for you to know where to go to get your vaccines and to support you in doing that. And those plans are consuming us many hours a day. So yes, we will be reaching out, and all of those details will be coming out in the next couple of weeks. And I know many people have been sending me questions about their own individual situations and families, and please be patient. we have not forgotten you. It will be coming out, and we will recognize that there are limitations that people have, particularly people who are older and not as mobile and maybe not using the internet. And we will be taking many ways to reach out to you and to make sure that you get the vaccine that you need. And we're calling on people in the communities across BC to help us with this. And there's been quite a lot of outreach and a lot of response. So it's very heartening. And I'm excited that we're going to be able to get these mass vaccination clinics going and protect people in our communities.
Thank you. The next question comes from Richard Zussman. Richard, go ahead, please.
I'm wondering about the federal measures that came into place today, targeted flights in many regards where people on the East Coast travel. Here on the West Coast, we're more likely to travel places in the United States like Hawaii and California and Arizona. Does it concern you at all that those flights are still running? And is there any sense that we're getting here in BC from the federal government as to why those U.S. destinations were not included?
We did have some discussions about this, and I can't say all the details, but we understand that Canada is having ongoing discussions with our neighbours to the south, with the United States, as they are updating and revising their border measures. So I expect we will hear more about that in the coming days. People from BC do go to Mexico quite a bit, and myself, I'd be running away to the Caribbean if I could, but that's not in the possibility this year. So yes, I think there's more discussions happening, and I expect we'll hear more.
Richard, do you have a follow-up?
I do. Now that we're at the point where everyone in long-term care has been offered the vaccine, is the idea of any semblance of rapid testing for long-term care staff out the door? I know this has been a debate and you field these questions a number of times, but is this no longer up for discussion considering we're getting to the point of full vaccination in long-term care?
Yeah, so I think my views on using rapid testing in long-term care have been expressed by others as being dichotomous, and I will say we are using rapid tests in long-term care and have been. We've been using them in the downtown east side, in shelters, in correctional facilities, in communities, in residences, in every place that we think they may be of value. And yes, we've done, when we have outbreaks in particular, and for many months it's been part of the routine that we have testing of all staff and residents on a regular basis. And in some instances, we use the rapid test for doing that in between times, for staff in particular, sometimes for residents. So I absolutely am looking at every possible use of these rapid tests. But I will also say that they're not simple. They're not. They do take resources, and they take commitment from staff and from the facilities themselves. And the pilots that were done in 5 long-term care homes in Vancouver Coastal really showed that you really had to have staff resources from the facility as well as medical staff resources, and we can train people like medical students and nursing students and others to do it, but you have to find them as well. And right now, our focus has been on supporting staff in an outbreak. It's such a challenging situation, and we know that staff shortages and people coming into work to support each other has been a large part of that. So it's part of a many different pronged approach to long-term care, and absolutely immunization has been the single most important thing that has helped us right now. Whether we use rapid testing in areas where access to the gold standard is not as timely, that will continue, but we will continue to use the gold standard PCR testing where our turnaround times are very short in most places.
The next question comes from Moira Witten, the Tyee.
Hi, thank you so much for this. Regarding the vaccination plan and 4-phase strategy released last week, some people with disabilities and conditions not explicitly mentioned in the plan to join in phase 3 are saying that doing vaccination strictly by age is ableist and will leave them extra vulnerable or at their heightened vulnerability for months longer than is necessary. What do you say to that?
Yeah, I think if you look at, there's a group of people who are most at risk, and we have identified those people, and we will be reaching out to them, and many people with disabilities fit into those categories. And yes, most people are part of organized medical clinic and others, and so we'll be using different strategies to reach out to that group of people. My partner, Dr. Danielle Bain-Smith, my Deputy Provincial Health Officer, has been engaging with the disability community through the pandemic on behalf of our office, and we'll continue to do that to make sure that we can reach out to that community. But the reality is, we have limited vaccines, and not everybody can be the first in line, and we're doing it on the basis of risk and making sure that we have all of those other things that protect people, keep them protected. And yes, it may be a matter of weeks, but this is something, it comes down to saying, do we bump somebody who's 90 and living on their own behind somebody who's in a group home with a disability? And these are just terrible, terrible things to try and have to wrestle with. So we've based it on risk and making sure that we have the measures that we need in place to keep protecting those people who are most vulnerable. And we will be connecting, as we continue to do, with the disability community and others as we move through these next few months.
Do you have a follow-up, Moira?
I do, thank you. I know concern in other jurisdictions around the prevalence and reproduction rates of the variants you've reported on is quite high. So I'm wondering, why is BC considering a COVID-0 plan once transmission is further under control, or do you see that as a goal for the province in the coming months?
So, I think what has been expressed, including in your paper around COVID-0, is likely not a reality for a jurisdiction such as ours, where we have so many land borders and ways that people move in and out through this province. Particularly, our biggest risk continues to be from the United States and the people who move back and forth across our borders from the U.S. And that is a reality of where we are geographically in the world and where we are in our social economic interactions in the world. It's nice, and I know here on Vancouver Island, people could see a vision of wrapping ourselves in shrink wrap and not letting anybody in, but that again is not realistic in our context. We have so much essential travel. I think about this past winter, or I guess it was before the pandemic, and we had a couple of days of really bad windstorms where the ferries couldn't come to Vancouver Island, and grocery stores were running out of groceries. We are that dependent on movement of goods and services across our borders that I don't believe the New Zealand model of COVID-0 is achievable in this province. Obviously, we want to get this as low as we possibly can, particularly in people who are most at risk of either working in or being vulnerable to severe infections and hospitalization and death. And as I mentioned earlier, the more transmission you have, the more likely it's going to be somebody is going to have a more severe illness, even a young person, and the more the virus can replicate, the more chances are we're going to get another variant or mutation that's going to have some advantage and give that virus a chance to spread more widely. So our goal is to minimize morbidity and mortality. That's the important part, and to do that, we need to minimize transmission as well.
Thank you, and we have time for one more question this afternoon for everyone listening today. There will be a statement released this afternoon with the latest information on cases, Hospitalizations and Outbreaks, which you can find at news.gov.bc.ca, for medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, do visit bccdc.ca. For information about the province's pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Susie De Silva, CBC.
Thank you very much. Dr. Henry, can you give us a breakdown of where exactly the cases are occurring, sort of with the data to back it up? For instance, are we talking about 75% of the cases that we're seeing happening in workplaces? Are we talking about 50% from small group gatherings at home? All this week we've heard a lot about doing more, and speaking to a lot of people, they say if they understood exactly where this was happening, it would help them to do more. So can you break it down with some data in terms of where we are seeing these cases? And if you're not doing that, can you explain why not?
Yes, well, we've tried to do this multiple times, but it is not that simple. And you will have remembered that I presented a number of scenarios where somebody transmitted in a gym, and then one person went to a wedding and it transmitted to X number of people. So I can tell you that about 30%, 40% of the cases we are seeing right now are related to workplaces. But what does that tell you? It tells you that it's not so much the public interface. So we're not seeing it in people who are shopping at Costco. What we are seeing it is in people who are working together. And so we have been, as I've said many times, been working with WorkSafe to enhance the guidance, to go in and to do inspections, to do investigations where we're seeing workplace transmission. So we see, for example, a number of food processing plants where we've had high numbers of people. So when you talk about the percentages, it's not that simple either, because you could have a large outbreak in a food processing plant, or we can have a small one that's caught early, and it's still, the risk is the same. So what we've been telling people, these are the situations where we are seeing transmission. We were seeing a lot of transmission. About a third of it was from social events, including weddings, birthday parties, all of the different social occasions that we have together. And when we put in the event restriction order, those have gone down. But we are continuing to see clusters, small numbers of people that are transmitting, and then it spills over into the workplace. It spills over into a long-term care home, because I went to a birthday party with 6 people, and those 6 people worked in 3 different places. So it's really challenging to try and say it's exactly this or it's exactly that. These are all interconnected and interrelated. Where we are seeing transmission now are in small social gatherings in places like Fernie, in places like around Williams Lake, in places like Whistler. We see them when people have people over to their house. We see them when people are living in group accommodations. And so it transmits in those environments. We see it in workplaces as well, in many different settings in the workplace, not necessarily at the public interface, but it's when we're in meetings together, not wearing masks in crowded conditions, having lunches in lunchrooms, having breaks together. Those, unfortunately, are situations where the virus can transmit more easily.
Do you have a follow-up, Susie?
Yeah, we understand that there is a vaccination clinic taking place on the downtown east side today. I'm just wondering if that means we're a bit ahead in the rollout plan. I know it said February. I know we're only a few days away, but does that mean we're a bit ahead despite the supply issues that we've had? And can we get the answer in French, please?
Sure. No, the issues that we're seeing in the downtown east side are related to what I just mentioned a few minutes ago about shelters. So we are seeing outbreaks in people who are underhoused and homeless in the downtown east side, and also in areas of Fraser Health in Surrey in particular. So this clinic is to try and address some of those more at-risk people who live and in the downtown east side neighborhood. It's also, what we're finding is that it's related to the outbreaks at St. Paul's and in facilities in the Fraser Valley as well, or in the Fraser Health Authority as well, because people who live in the downtown east side, when they get sick, they often go in to St. Paul's. So it is trying to address the outbreaks and clusters that we're seeing in those communities. And before I turn it over to Minister Dix, I did want to make one other thing clear. It was a question that came in about whether I have received my second dose of vaccine, and the answer is no, I have not. I absolutely believe in the data that we have that shows that extending the interval between dose 1 and dose 2 is not only safe, but there's a very real probability that it will provide more durable and longer-lasting protection. So I will be waiting until there's sufficient vaccine available later on in the spring.
Oui, aux régions du centre-ville de Vancouver à l'est, il y a des cliniques actuellement. Il y a des gens qui vivent ensemble, effectivement, dans les abris dans la région, qui ont besoin de protection, et surtout parce que cela a un effet évident sur l'hôpital Saint-Paul. C'est important de le faire. Ça fait partie de notre plan dès le commencement. C'est de répondre aux questions urgentes, dans notre plan de vaccination, mais aussi de vacciner des gens surtout dans le domaine de la santé qui sont essentiels et où la vaccination est nécessaire. Donc, on a mis l'accent sur le secteur de long-term care, mais il y a aussi des régions et des endroits dans les régions qui ont besoin d'aide actuellement. Donc, on a tout petit peu de vaccins actuellement et on va l'utiliser d'une manière stratégique pour limiter la transmission, surtout pour ceux qui sont les plus vulnérables. Merci beaucoup. Thank you very much. We'll see you on Monday.
Thank you very much. That's all the time we have today. Thank you for joining us.